Mrs. Princey, Associate Professor in Mental Health Nursing. Right. Today I'm going to discuss about the various other drugs which are used in whether we have got many psychiatric disorders like where we have got the sleeping disorders, eating disorders, dementia. Okay, these are all the various disorders that are there in the psychiatry. We are using certain drugs for treating these conditions. So these drugs are grouped under a separate category called as miscellaneous drugs. Right. So today I'm going to discuss about the drugs which are used for these conditions termed as the miscellaneous drugs. Yeah, these miscellaneous drugs includes the drugs which are used in the eating disorders, drugs which are used in the de-addiction, drugs which are used in the childhood psychiatric disorders. We have got some vitamins which are used, calcium channel blockers, and we have got the drugs which are exclusively used for treatment of dementia. Right, so these are the various topics that you're going to see in this particular video. First, let us see the drugs which are used in the treatment of eating disorders. So when I say the eating disorders, we have got two conditions. One is the anorexia nervosa and the bulimia nervosa. In the anorexia nervosa, what is happening is the client himself or herself is voluntarily practicing certain methods like starving, okay, self-starvation without eating any food substances. So just to lose the weight, just to maintain a body figure, right? So that is what is the anorexia nervosa. So in these conditions, we are using certain drugs which are going to help the patient out. Why the client is doing such a thing is because of the fear and anxiety of gaining the weight, right? So we are using certain drugs to control the fear or to control the anxiety, and also we are going to use some stimulants to stimulate the appetite of the client in the anorexia nervosa. So the drugs which are used are, first one is the neuroleptic drugs, example the haloperidol, flufenazine. Okay, so that is the one group of drugs. The second is the appetite stimulators to stimulate the appetite of the client. We also use the antidepressant drugs since the client may go for depression, right? So we are using the antidepressant drugs. Examples we have is imipramine. Right, the next condition which you see the eating disorder is a bulimia nervosa. As the name says, bulimia, here the client is also having the fear and anxiety of gaining the weight, but he will do the binge eating. So within few hours, within say for example 2 hours, he will binge eat certain food items which are very fatty content and which are very sugary. Right, so they binge eat it, and later on they feel guilty about the behavior what they have done, and they start inducing the self vomiting, or they may do excessive exercises, use of laxatives. So all these things are the practices that they may do because of fear of gaining the weight. So here also the client may go for the depression. So we are using certain antidepressant group of drugs. So widely used antidepressants here are TCAs and SSRIs. The TCAs, tricyclic antidepressants. Examples we have imipramine, amitriptyline, clomipramine. So these are the drugs. Moving on to the selective serotonin reuptake inhibitors group of the antidepressants. Example fluoxetine and sertraline. So these are the drugs which are used in the bulimia nervosa. Moving on to the next group, which is the drugs which are used in the treatment of dementia. So you know very well, dementia is a organic brain disorder wherein the client or the person will be having difficulty in his memory, will not be able to remember, right? Problem with the memory. So we have got few drugs which are used for improving the memory of the client. Number one, tactrin hydrochloride. Number two, we have donepezil hydrochloride. So these are the groups of drugs that we are using. These are thought to be the cholinesterase inhibitors. So what is the mechanism of action here? So these groups of drugs are going to act on the neurotransmitter acetylcholine, wherein they're going to increase the level of acetylcholine at the synapse. So that is the action of the cholinesterase inhibitors. Examples we have donepezil, rivastigmine and galantamine. So these drugs are going to help in improving the memory and also going to bring about considerable changes in the personality as well as the mood of the client. So that these are the drugs which are used in the treatment of dementia. Apart from these drugs, we can also use the antipsychotic group of drugs if the client is having any conditions of psychosis. Example, we have the haloperidol and the risperidone. If the client is having any kind of anxiety or insomnia, we'll be administering the benzodiazepine group of drugs. Antidepressants, anticonvulsants, as well as for vascular dementia, we'll be using the aspirin. Okay, so these are some of these drugs which are used in the treatment of dementia. Moving on to the drugs which are used in the treatment of extrapyramidal symptoms. So you know very well what are these extrapyramidal symptoms. They are nothing but the major side effects of the neuroleptic drugs or the antipsychotic drugs. So when the patient is on these group of drugs, the antipsychotic drugs, there may be chances the client may develop these extrapyramidal symptoms. Now, why is the client developing this extrapyramidal symptom? When these antipsychotic drugs are administered, it's going to act on the D2 receptors, right? So these drugs are going to block the D2 receptors in the midbrain part of the brain stem. So that is why there is a extrapyramidal symptoms which are seen as the side effects of the antipsychotic drugs. So these side effects are sometimes, very much emergency that they have to be treated immediately. So, number one treatment for this condition. So, for example, if the person is having the neuroleptic malignant syndrome, so if the client is having neuroleptic induced Parkinsonian, sorry, if the client is having neuroleptic induced Parkinsonian side effect, then you will be administering the anti-Parkinsonian agents, right, to treat this side effect. So, what is the mode of action of this anti-Parkinsonian agent? So, it is going to bring about an imbalance in the neurotransmitters. That is, there is going to be a deficiency in the dopamine level, right? Which is going to increase the cholinesterase activity. So, that is what is the mechanism of action of the anti-Parkinsonian agents. The second action is it is going to restore the natural balance of the and the dopamine in the CNS. So let us see the drugs which are used. Number one anticholinergic agent which is used is the trihexyphenidaine. Okay, which is very commonly used. We call it as THP, trihexyphenidaine, which is anticholinergic property. The chemical class of the drug is synthetic tertiary amine. The trade names of these drugs are Artane, Pacitine, as well as Parkin. Okay, so you would have learned or heard about this drug Parkin. Okay, moving on to the indications of these drugs THP, we have got number one indication is the Parkinsonian symptoms, which is induced by these anti-psychotic drugs. Number two, we have got the spasticity, closed closed craniocerebral trauma, trigeminal neuralgia, as well as the nicotine poisoning, right? So in all these conditions, we use the drug trihexyphenidaine. Let us see the contraindications of this drug. Acute narrow angle glaucoma, paralytic ileus, prostate hypertrophy, and in the conditions of urinary retention, so these drug is contraindicated. What are the special precautions you have to keep in mind when you use it in case of history of epilepsy and also the recent history of myocardial infarction? You have to use with a special precaution. Moving on to the dosage of the drug in case of the adults, okay, it is used orally. Initially, we start off with 1 mg per day. Later on, after 3 to 5 days, the dosage may be increased based on the condition of the client. We also use the other drugs in these conditions. So one is the piperidine as well as the benzotropine drugs. Okay, so these are the drugs which are used in the treatment of extrapyramidal symptoms. The next extrapyramidal symptom that we have is the acute dystonia. So even in these conditions, we have got the list of drugs that we are using. Number one, we use anticholinergic agents or the drugs, antihistaminergic group of drugs that we use. dopamine agonists that we use, for example, bromocriptine, carbidopa, levodopa, beta adrenergic antagonist, and benzodiazepine group of drugs. So these are the list of drugs that we use in acute dystonia. The next extrapyramidal symptom is the akathisia. So, in conditions wherein the client develops akathisia, we use these drugs, propranolol, benzodiazepine group of drugs, as well as the clonidine. Next is the neuroleptic malignant syndrome. So, in the neuroleptic malignant syndrome, the group of drugs that we use are diazepam in case of muscle stiffness, dantrolene in case of malignant hyperthermia. We use bromocriptine, we use the amantadine, and levodopa. So these are the group of drugs which we use in the treatment of neuroleptic malignant syndrome. Moving on to the nurse's responsibilities when the client is on this group of drugs. So number one responsibility, observe the client for the side effects of the anti-Parkinsonian agent. So it can be we use in Parkinsonian disorders, right? So in those cases, anti-Parkinsonian drugs, when they use, they are going to develop some side effects, right? So it can be palpitations, tachycardia, sedation, drowsiness, blurred vision. So these are the side effects of the anti-Parkinsonian agent. So you have to monitor and observe the client develops these conditions. Maintain an intake output chart. That's a very important thing that you have to do. Encourage to take adequate amount of fluids in the diet and enough of fiber in the diet to avoid the constipation. Monitor and record the blood pressure, the pulse, as well as the respiratory rate when the client is on the anti-Parkinsonian agents. Every 4 hours, you need to monitor the vitals. Educate the client not to stand up immediately from a lying down position because there may be chances of orthostatic hypotension. So encourage the client to first get up and sit on the bed for some time and then only to stand up to reduce these effects of these drugs. When the client is on the anticholinergic group of agents, there may be chances of drowsiness, dizziness, blurred vision. So educate them not to use any machineries or not to drive any vehicles because there may be chances of accidental injuries. Another important thing, you have to record all your recordings. It can be the side effects, the medications that you administer, or what are the effects that you can see in the client. So all those you have to do the recording. If you notice any kind of a side effects, inform the physician immediately. Stop the drug and inform the psychiatrist or the physician. So these are the responsibilities of the nurse when the client is on the anti-Parkinsonian agents, anticholinergic agents, which are nothing but which are used for treatment of extrapyramidal symptoms. The next one is a patient as well as family education, right? So very, very important that you have to see that you give the education to the patients as well as the family members. Number one thing is you're going to educate them not to use any kind of machineries or to work on any kind of equipments or not to drive because there may be chances of side effects of dizziness or blurred vision. So that is one thing that you're going to educate them. Second thing, you're going to educate them about the orthostatic hypotension. So not to, wake up immediately from a lying down position can cause sudden hypotension. So educate them to first get up, sit on the bed for some time, and then only to move out of the bed. So that education you will be giving. The third thing that you will be giving is encourage them to have a lot of fluids in the diet and also a lot of vegetables or we can say the fiber rich roughage in the diet so that it can avoid the risk of constipation. Okay, another important thing that if in case there may be chances that a person may have the glaucoma or any kind of a blurred vision, right? So you have to encourage them to go for eye checkup, routine eye checkup, which can be done to detect the chances of blurred vision or the glaucoma, right? So these are the education that you will be giving to the patient as well as the family member. So this is about the miscellaneous group of drugs which is used in the field of psychiatry to treat the various conditions of eating disorders, can be a dementia, especially the extrapyramidal symptoms. We will be administering these drugs, which is the TPH drug. Okay, anticholinergic group of drugs that will be administered. Anti-Parkinsonian drugs when the client is on, he may develop the side effects. So always encourage the family to identify these side effects and to report it immediately so that we can treat it. Hope you all have understood the topic.